Hi Calrossy community, it's nice to be able to speak to you at the start of week 4, now that we've settled into the routine of term 3. But I want to give you a bit of an update about COVID-19 because the health authorities continue to tell us not to be complacent. I've had some contact with parents, students and staff a little bit concerned about the situation in Victoria, but also with the outbreak of some hotspots in New South Wales. So I wanted to reassure the community that we're continuing to be very careful and follow the health regulations as they're given to us at school. We've amended all of the things that we're doing to support the best health of students and staff. We are having assemblies, but they're being done outside where we can. They're being short. We're restricting the furniture, the way the students come in and out, because we believe it's important to get together, to get that sense of community that supports students through a hard time. Some of you will know that we have discontinued temperature checking. The reason for this is that all of the children and staff that we've sent for testing have been identified not from the temperature check, but because they've been showing symptoms of cold and flu. So one of the important messages to parents, staff and everyone in the community is if your child is sick, keep them at home. If they're showing symptoms, it's the normal symptoms, cold, flu, runny nose, those sorts of things. We know it's annoying and it's irritating because sometimes someone can be entirely fine. But for the protection of the whole school community, we're asking you to do that. I've put out a bit of an update that will come through on our website and to parents directly, just giving a little bit more information, because if you're staying at home for not being well, you are advised to go to the respiratory clinic. It's very easy. It's a quick phone call. It's a drop-in. It takes just a couple of minutes and the test results come back very quickly. If you do choose to have your child checked or tested, could you please let us know of the result? If it's positive, of course, we would know very, very quickly. The good news, of course, is that in our community, we're now over 120 days since there has been a case, but I do know that there were a couple of cases in the Hunter Valley, in northern Sydney, that have had people watching very, very carefully. But again, in the population of 5.2 million in Sydney, we're still talking about between 10 and 15 cases a day. So obviously important that we keep safe, follow the rules and regulations. If you have any concerns about your child, anything that I've said, anything that's in the COVID update, please talk to our health staff here at school, because our aim is to protect our community, to keep us all safe and to keep well. Now, 2 other things I'll mention just while talking about these things. The well-being of our community is really important. I've alluded to that before. It's great that we've got community sport happening, but we want to keep kids engaged, but we know that some of our children are finding this hard, both old and young, being restricted from seeing grandparents, all sorts of things. If you have concerns about the well-being of your child, please let us know. In the same way that if we see signs or symptoms, we'll talk to you. The final thing concerns transport and travel to and from school. I know some people are being more cautious about putting children on buses and driving. Please be careful with the drop-off and the pick-up. With more cars, there's a little bit of stress and strain. It takes a little bit more time for the pick-up. Be patient, because again, we want to keep the children safe. An extra couple of minutes for everyone to be safe is well worth it. Just to let you know that late last week we did have a child from another school knocked over by a car very close to our school. So I just want to stress and emphasise, please be careful, be safe, and that as a community we will stay strong and get through this. Thank you.